Chapter 19, Non-Gonorrheal Urethritis. Non-gonorrheal urethritis, as distinguished from post-gonorrheal urethritis, may be classified as follows. Nonspecific or, quote, simple urethritis, tuberculous urethritis, page 433, traumatic urethritis, neoplastic urethritis, syphilitic urethritis, herpetic and eczematous urethritis, urethraria, prostatorrhea, spermatorrhea. Nonspecific urethritis. Nonspecific urethritis may be defined as an acute urethritis due neither to the gonococcus nor to the tubercle bacillus, and usually excited by no known cause other than sexual excitement or contact. Under this caption, we may also include the so-called urethritis ab ingestis and diathetic urethritis, neither of which seems to occur in virgin urethrae. Urethritis ab ingestis. Certain substances taken into the stomach may occasionally produce a mild urethritis. Among these, alcohol holds a high rank. Excessive potations, notably of beer or champagne, or prolonged excesses of alcohol in any form, will occasionally, without other cause, produce urethral discharge. As an adjuvant to sexual excess, the influence of alcohol is paramount, more particularly if there be already a pre-existing patch of chronic inflammation anywhere along the urethra. Cantharides, arsenic, purgative mineral waters, iodide of potassium, turpentine, asparagus have all been accused of lighting up mild urethral inflammation, but the rarity of such attacks makes their consideration trivial. Diathetic urethritis. A gouty urethritis is accepted in England, and a strumous urethritis has been mentioned, but as essential maladies, both are a refinement of diagnosis. The gouty old gentleman with densely acid urine is more liable to discharge because of his gout, and treatment of the latter may be essential to his recovery. There are also well-observed instances of the appearance of a discharge from the urethra upon the subsidence of an arthritic eruption upon the skin, and Desnos alludes to the sudden appearance of a spontaneous urethral discharge during the course of the grip, believing it due to small prostatic abscesses bursting into the urethra. These diathetic agencies are then surely concomitant factors, if not essential causes, of primary urethral inflammation, yet they are extremely rare. Etiology of simple urethritis. That the normal male urethra is immune to infection by any bacterium except the gonococcus is almost, but not quite, universally true. Most, if not all, cases of so-called simple or non-gonorrheal urethritis occur in urethrae damaged by gonorrhea or by sexual excesses. Indeed, when the simple urethritis occurs in a canal that has not previously harbored the gonococcus, its origin will usually be found, not at the meatus, but in the prostate and seminal vesicles, evidence of its sexual cause. The bacteria found in the normal urethra are those usually found in simple urethritis. But such important questions as, is the bacterium an etiological factor, and is simple urethritis transmissible, have not been adequately answered. It seems probable that non-gonorrheal urethritis is sometimes transmissible. I have obtained a streptococcus from the urethra of a man with simple urethritis, similar to that obtained from a vulvar abscess in his wife. A few similar cases have been reported, but they are most exceptional. In the opinion of the lady, nonspecific urethritis may be acquired from a non-gonorrheal woman at or near the period of menstruation. This opinion has as little foundation as that which attributes infectiousness to non-gonococcic leukorrhea. The male who acquires urethritis from a menstruating or leukorrheic woman with whom he has previously cohabited with impunity acquires gonorrhea. Pathology. The lesion is a mild glandular catarrh. It may be most marked in the anterior urethra or in the prostate and vesicles. Symptoms. Simple urethritis is usually a very mild inflammation. There is little or no swelling of the meatus. The discharge is mild and often only mucopurulent. Urination and erection are not painful. The incubation may be but a few hours or many days. The inflammation may last but a day or two, or it may last many months. These facts suggest that the condition of the patient's urethra and general health are of more importance than the bacteria. The duration of the attack may be out of all proportion to its severity. I have known one to last several years. Diagnosis. Simple urethritis is distinguished from gonorrhea by the absence of gonococci from the discharge. The mildness of the attack may be suggestive, but is not absolute proof. The lesion does not require diagnosis until the first outbreak of discharge has been controlled by local treatment, but then a complete diagnosis should be made by rectal examination and urethroscopy. Treatment. At the outset, the condition should be treated expectantly, i.e. by sandalwood oil, astringent injections, and sexual hygiene. Many cases are thus cured in a few days, but whether cured or not at the end of a week or so, the urethra should be carefully explored by sound and urethroskop, the prostate and vesicles by massage, and treatment instituted as for the cure of chronic gonorrheal urethritis.